Hello and welcome to the Ending Body Burnout Show. We're your hosts, Chris and Philly, co-founders of multi-award-winning functional medicine practice, serving busy people with energy, mood, and gut issues.
Well, busyness, overworking, addictive doing, and perfectionism might be the norm. It's not normal, and it's a major contributor to health issues.
Our goal with this show is to give you a holistic root cause approach to healing your body so that you don't have to continue doctor or diet hopping or popping a gazillion supplements hoping something might stick.
So get ready to heal your body, get your spark back, deeply connect with yourself, and step into the life of your dreams. Let's dive in. Hello, it is Philly here on the Ending Body Burnout Show. I am so excited to bring you today's episode with Dr. Nirala Jacobi. Now, this woman is amazing. She is a wealth of knowledge of all things SIBO, or small intestinal bacterial overgrowth. Quite a few years ago when I started practicing in functional medicine, I felt like there was a missing link in what I was doing in terms of gut health, doing a lot of comprehensive stool tests and looking at the large intestines and pathogens and leaky gut. But I found that there was some clients who had really tricky health issues that weren't getting better with my usual methods. And so that's where I came across SIBO and Dr. Nirala Jacobi. So she's known as the SIBO doctor here in Australia, and oh my gosh, did all her courses, all her certifications, had some one-on-one mentor sessions with her, and she has been a huge part in our practice and especially how we treat certain health conditions, including SIBO. So just as a recap or a bio about Dr. Nirala Jacobi. So she's a naturopathic doctor, an internationally recognized expert on small intestinal bacterial overgrowth, or SIBO. She is the creator of the SIBO Biphasic Diet, a resource that has helped tens of thousands of SIBO sufferers around the world. And if you've worked with us, you have seen that this is a protocol that we use when treating SIBO. Dr. Jacobi is the host of the SIBO Doctor podcast and the founder of the SIBO Doctor, an online educational platform that includes a practitioner certification program. She is also the medical director of SIBO Test, providing innovative testing options for SIBO and IBS. Dr. Jacobi is known for her systemic and effective approach to diagnosing and treating SIBO and other functional digestive disorders, having received her naturopathic doctorate in 1998 from the esteemed Bestar, I think I've pronounced that right, University in Seattle, Washington. She brings more than 2 decades of clinical experience and expertise to her patient clinic, the Biome Clinic. So without further ado, let's jump into today's episode. Okay, so excited to have Dr. Nirala Jacobi on our podcast today. Fangirl here. As I said in the intro, she has been a pivotal mentor in our own practice, especially in regards to gut health and treating SIBO. So let's dive in. How did you become a leading expert in gastrointestinal health? And what got you into specializing in this area?
Well, first of all, thanks for inviting me onto your podcast, Philippa. It's really nice to chat with a colleague who has herself so much knowledge in this field. So basically, I was a naturopathic doctor in America, primary care physician role in Montana. And basically, I treated a lot of digestive disorders because people have crappy diets, they have a lot of antibiotic use. And so we're very familiar with this type of presentation where somebody just has digestive issues. And so I always loved that side of naturopathic medicine because we believe the gut is the root of the tree, right? Without a healthy digestive system, we really can't be healthy. And so we see a lot of systemic illness actually arise out of digestive conditions. But I'd never heard of SIBO until I actually went to a conference in 2011, and a couple of colleagues had raised this topic, and it was like a light bulb went off in my mind. And it was like, this is the missing link of people that are just not improving with the things we do to help them overcome IBS and dyspepsia and reflux and gas and bloating and all the rest of it that we know about SIBO and as a major cause of IBS. And they weren't improving with these very well thought out protocols. So I just dove into the research and also started testing my patients, and I wasn't satisfied with how the testing was done. So I started my own testing company here, and that's been going for about 10 years now. And basically, I found that it's just one of those really, it can be very complex, but it can be very simple, but it can also be very complex. And you and I have had conversations about how complex it can be and how many faces it can have. So, but yeah, so it's been about 10 years, and I feel like I have a really good grasp of what SIBO is now.
Yes, I had some sessions with you where I'm like, oh my gosh, tricky client. I've done all the things. What now? And the things that you would just reel off that I hadn't even thought about, I'm like, this lady knows her stuff.
Well, School of Hard Knocks. Like, I've been in practice for 25 years, and you just have to think laterally. And as you know, there's so many different aspects to what we do. And the more we learn about different stuff, like the genomic stuff, for example, that was a whole piece that I had to learn myself to really understand what kind of genomic contributions could mean that somebody has a hard time overcoming SIBO, for example. So that was also, I was learning along the way, a lot of it.
Yeah. So our podcast is dedicated to helping busy people who often have the patterns of overdoing, high achieving, perfectionism, people pleasing, and their body burnout. Do you see a link between this type of people or like the behavioral patterns that they have and gut disorders?
Well, absolutely. Yeah, that goes without saying. With SIBO specifically, I have to say it's usually the people that have a hard time overcoming SIBO. It's not so much the underlying cause of SIBO, that somebody has a lot of stress and that causes SIBO. It's not usually, it can be definitely a participating issue that entrenches somebody in chronic SIBO. But SIBO has very specific underlying causes. And sometimes, yes, if somebody has really sort of massive stress for many years, that can affect it to a level where it's possible that it can affect the upper gut motility. But just standard stress that we see day to day will definitely affect digestive disorders, but not necessarily cause SIBO. I hope I was clear.
Yeah, it's kind of like it can affect the things that then can lead to SIBO. So especially with the digestive organs not being able to produce stomach acid and the gallbladder producing bile, and it can kind of shut down those things. What about with motility? So for people who don't know what that is, can you explain what that is? And then do you see, like, is there a bit of a nervous system or stress link with motility?
Sure. I'm kind of unsure if your audience actually knows what SIBO is. I'm sure you've had other podcasts about it. Should be.
Yes, I have talked about it, but how about just in case someone this is the first time they've ever listened? First time,
and actually, someone just sent me a photo of. I think it was Who Wants to Be a Millionaire. It was actually a question
I saw that
on Australia Who Wants to Be a Millionaire. What is SIBO? So it was pretty funny. It's coming into the vernacular. But basically, SIBO is a condition where bacteria that are normally in very small amounts in the intestinal tract or in the small intestine are overgrown, and that's a problem because this is where we absorb our nutrients, where we digest our food and absorb our nutrients. And this area is so vital for our well-being that there are lots of different checks and balances in place from the body to ensure bacteria don't overgrow. So you mentioned stomach acid. We make healthy amounts of stomach acid to digest to start the process of unraveling proteins and breaking them down into peptides and pancreatic enzymes. Further this process, and then we also have bile that's secreted from the gallbladder to help emulsify fats, and all of this is also, these digestive juices are very bacteriostatic, so they prevent bacterial overgrowth. But then we also have a very strong motility wave in the small intestine that's sort of imperceptible to us for the most part. Sometimes when your stomach is really growling because you're hungry, that's actually the migrating motor complex, which is part of the enteric nervous system. And it is a sort of cleansing wave that ensures that the small intestine is kept relatively free of bacteria. And it sweeps out the food and along with it, any sort of bacterial, massive bacterial overgrowth for the most part. So those are the primary, checks and balances that exist to prevent bacterial overgrowth. But when you have a situation that, like, for example, a case of food poisoning has happened to you, and that can actually damage the migrating motor complex because it induces an autoimmune response that then damages this cleansing wave. And so even though your bowel movements may not be affected, you may still have some problem with motility. And as you mentioned, there are also other conditions that can affect the motility of the upper gut. And that's a major sort of category of what causes SIBO.
Well, while we're on that topic, what are some other ways that motility can become damaged?
Well, independent of the migrating motor complex, we also have vagal dysfunction. And certainly you have probably talked a lot about this on your podcast, because it is very in vogue to talk and to mention the vagus nerve, because it is so important for our digestive tract. So for your listeners, you've probably talked about the fight or flight syndrome, response, I should say, where we have the autonomic nervous system that regulates how we respond to perceived threats. And the sympathetic nervous system is also known as the fight or flight. And then you have the rest and digest, which is the parasympathetic nervous system response. And the parasympathetic nervous system is very much related to the digestive processes, as the name implies. And an integral part of that is the vagus nerve, which innervates many organs along the ways. So it's, when you have massive stress, that can definitely affect the autonomic nervous system and the vagus nerve itself, which is considered the main highway between the gut and the brain, also known as the gut-brain axis. So there's a lot there that's not necessarily just related to motility, but other factors as well.
Yeah. And then also surgery. So I find that a lot of women who have had endometriosis often also have gut issues.
Yeah, so that's the other category of underlying causes. So in my mind, there are four main categories of underlying causes. One is the motility aspect, which sort of covers the migrating motor complex. So damage to that, whether that's, like I said, through food poisoning or other types of infections that can also cause that. And then you have the gut-brain problem or the vagal issues and the high stress and mold issues, right? So mold toxins can actually affect motility because mycotoxins exert a certain toxicity to what we call the myenteric plexus, which is part of the enteric nervous system. And people that have chronic mold exposure very often have SIBO that you can't really treat until you've treated the mold. I don't know if you found that, but I certainly have experienced that a lot. And so, and then the other category is structural issues, which includes endometriosis. It includes any sort of surgery, whether that's cesarean or gallbladder removal or appendectomy or any of these very routine abdominal surgeries injuries can actually cause scar tissue and affects how food moves through the digestive tract, not because of scar tissue inside the digestive tract, but inside the abdominal cavity that then creates sort of barriers to proper movement through the gut. And then the fourth category is more medications that also affect mostly motility in the gut. So all in each category has several different conditions, as you know, that has to be sort of ruled out. Another big one with motility, for example, is hypothyroid, right? Hypothyroidism.
Yeah, yeah. And hypermobility too.
Yes, EDS.
Yeah.
EDS has also the structural problem. So we see much less motility because of the loss of connective tissue in the gut wall. So there are lots of different reasons why it's not as easy as just killing bacteria, right?
It'd be great, wouldn't it? It's just like take these antibiotics or herbs and done. Or elemental diet's probably not that easy. Just do the elemental diet.
Right.
We might touch on that sort of stuff in a second, but what are some really common symptoms then that you see with SIBO?
So, I see the really complex cases because that's what I do. People have already seen other practitioners, and yes, they had SIBO and they're still symptomatic or they're not clearing SIBO. There's lots of different reasons why I see people. So my little group of people that I see is very probably different, but for the most part, I'd say generally speaking, you see all the classic IBS symptoms, right? And IBS can be different for different people, but generally speaking, we have a lot of gas and bloating. Oftentimes, there's also abdominal pain, which is known as visceral hypersensitivity, which is very classic with IBS. And because remember that SIBO is actually a subset of IBS. And then we also have bowel changes very often. Not always. Sometimes people do have normal stools, but it's either a diarrhea pattern or a more constipation pattern. So and then you have other types of symptoms that can also be related to SIBO, but not everyone has them, like excessive belching or reflux or those would be probably the primary ones. I've seen so many different things be related to SIBO and clear up. Rashes, for example, acne rosacea, restless leg syndrome, fibromyalgia, all those things or conditions are often also seen be comorbid with SIBO.
Yeah, actually the worst SIBO test in terms of the levels of the gases on the test that I've ever seen. This lady had no gut symptoms at all, and she just had quite a few food sensitivities and rosacea, and that was kind of her thing. But oh goodness, we worked on her gut and all sorts of things for quite a while, and while things got better, it didn't resolve. And I never really, in my mind, I'm like, oh, she doesn't have bloating, there's no digestive symptoms. That's why, we didn't do SIBO testing right at the start. But then by the end of it, it's like, let's just test SIBO. Let's just rule it out. And sure enough, super high amounts of hydrogen and methane gases. It was insane.
Yeah. And sometimes that can happen, that people are sort of very minimal with their symptoms. And it's a bit baffling when that happens, but sometimes I've had patients like that too, that they've had this so long that that's the normal for them. Right.
Yeah. So actually when you do the gut work and clear the SIBO, and it's like, oh wow, I actually didn't realize that I don't have to feel distended all the time. That was abnormal how I was feeling.
Right.
So testing then, because you mentioned earlier that you created your own way of testing SIBO because you were finding that the usual conventional, or not even the conventional, functional medicine way wasn't quite cutting it. Can you talk about that? Because there are quite a few different ways of testing SIBO.
Right. So by, the gold standards in terms of in-office testing, I would say is the lactulose breath test, which is pretty standard now, and you can get it definitely from different labs that do a decent job. But back 10 years ago, I just didn't see a lot of the reference ranges that I wanted, and the timing was, I want a 3-hour breath test, not a 2-hour breath test. So that's why I kind of just forged ahead and purchased the machines and all of that. But basically, it's still the lactulose breath test. Nothing has changed over the last 10 years with that. And we still only measure hydrogen and methane. There is a third gas that is produced by the bacteria if Fusarium or desulfovibrio is present in the small intestine, and that's called hydrogen sulfide. And we're not able to test that. There's actually just one lab in America that offers that, which is, it's kind of, I always want to have way more labs that offer that before my confidence level goes up in a particular, test. But anyway, so that's still there, but you can have lactulose breath test, glucose breath testing, and fructose. These are all different substrates that are slightly different fermented. So sometimes when you have a negative lactulose breath test, it's often helpful to follow up with a different substrate sugar to see if you have bacteria that maybe don't ferment lactulose. But for the most part, it's most people do ferment lactulose, I'd say. And then, there are companies that tout blood testing and stool testing. There is no stool test for SIBO, and that's because we have no way of accessing the small intestinal bacteria through a stool test. The stool just is representative of what's happening in the large intestine. And I know that there are a lot of people that extrapolate from that, because we know that the bacteria that produce hydrogen mainly are Klebsiella in E. coli, and we see that all the time, right? On a stool test all the time. That doesn't mean it's in the small intestine. So I think there's a lot of, practitioners are taking a lot of liberty when they're diagnosing patients like that, because it's a really distinct and discrete condition that is very, very different from large intestinal dysbiosis, because it does a lot more damage, right, in a small intestine. So that's that. And there is a new blood test that is just looking at antibodies to bacterial complexes. And to be honest, I'm waiting to talk to some of the scientists at that lab, but I really don't know how that can actually diagnose or differentiate between SIBO and leaky gut, right?
Yeah,
because
okay.
all you're doing is you're testing for immune responses to bacteria. Well, it could be that was 6 months ago, or it could be it was a year ago. So, and it could be that it was leaky gut, unrelated. It could have been, because of celiac disease or so. So I'm still really, I'm a bit cautious with my optimism about that test.
I think that's what I love too. So you have a lot of courses on your website, the SIBO Doctor, and because it can get confusing, especially if you're a new practitioner and you open up a catalog of all the lab tests that you could do, and even the gut side of things as well. Maybe it was you mentioned on the course, or maybe I was hearing it somewhere else, but some people were also trying to diagnose SIBO using an organic acid urine test.
Right.
Where there's a panel there that looks at, your flora and that sort of stuff. And if that's high, then some people are like, oh yeah, you've got SIBO, but that doesn't really work.
No, because first of all, an organic acid test only looks at your own organic responses to what's happening in your body. This is not location specific at all, right? They're looking at bacterial markers, and you have, in the entirety of your digestive tract, you have trillions of organisms. So it's very difficult to pinpoint location, impossible to pinpoint location with the hippuric acid and all those different markers on the bacterial section of a organic acid test. Yeah.
Okay. Treatment. Obviously, that could be a very long conversation, but generally speaking, what are the different ways that you teach practitioners and in your own clinic in terms of when it comes to treatment?
Yeah, and this is, my sweet spot, because I worked it out for over the years, that it's best, in my experience, it's best to do it in a sort of a really highly organized approach where you support the digestive process a little bit before you actually introduce antimicrobials. And what I mean by that is, because it's a bacterial overgrowth, a lot of people are just given antimicrobials or antibiotics, which are effective for the most part. But when you understand that SIBO causes brush border damage, right, and leaky gut, meaning that the enzymes that do that last crucial part of digestion are often damaged. Oftentimes we see histamine intolerance and other types of food intolerances as a result of SIBO. And we see detoxification impairments because of continued LPS absorption or endotoxemia because of this situation of E. coli and Klebsiella, a gram-negative bacteria. And to just drop antibiotics or antimicrobials often works, don't get me wrong, but my approach has been a lot more to support digestion and to remove fermentable a little while, and then people are really primed for antimicrobials without much of the die-off and sort of inflammatory response that can happen when you kill too many bacteria at once. So that's why I created the biphasic diet protocol, which basically divides the whole treatment into 2 phases. And I find that really very, very successful. But of course, SIBO, a lot of times when people, it's just a simple, I don't know if you see those people anymore, because I don't see the simple SIBOs, right? So maybe there still exist.
There is still simple SIBOs out there.
They don't need, yeah. Most of the time for me, it's been SIBO and this and that and neurological symptoms and insomnia and blah 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 blah. And so people need a lot more support in that area. But yeah, for the most part, treatment consists of going on a low FODMAP diet, if I can put it in a nutshell, right? So low FODMAP diet, which means a low fermentable carbohydrate diet. Then you can have a choice of either antibiotics, and typically that antibiotic is rifaximin if your hydrogen is high. A lot of doctors here in Australia don't like to prescribe neomycin because of the ototoxicity. So I often combine the rifaximin with Alimed or Alimax, which is a type of garlic extract that helps with killing methane. And, then there's different herbs for killing hydrogen as well. And then I always, depending on what other symptoms people have, I do peripheral support as well. And then when people are completed, I usually test again, because I like to know that it's completely clear. And then if I've determined that their cause of SIBO was from a damage to the motility aspect, then I add in a prokinetic, which is either a conventional prokinetic or a herbal prokinetic, which aims to reset the upper gut motility. So these are substances like ginger or artichoke or a number of other things I use to help with normalizing the motility in the small intestine.
Yeah, awesome. Elemental diet as well.
Yeah, I do. It's harder to talk people into the elemental diet. I do that mostly with really high gases and people that have failed other treatments. So the elemental diet is not like a whey protein or pea protein kind of formula. It's free form amino acids and glucose and basically fat, like some sort of oil, either medium chain triglycerides or something like that. So it's almost like a pre-digested formula that's also really great for peripheral support for people that have really inflamed digestive tracts, because it gets very easily absorbed. So people with a Crohn's flare or ulcerative colitis flare can do well with that as well.
Yeah. I I attempted it for myself when I was treating my own gut stuff. I lasted 10 days.
That's pretty good.
Maybe it was 12, but then I retested and luckily the SIBO was clear.
Yeah, that's great.
Like it was all worth it.
Yeah, so, that's good.
For those who don't know, the elemental diet is a kind of like a medicated formulated shake, nutritional shake, and you don't eat any food for 2 weeks and you're just only having those shakes. Sometimes
and it works. It works.
Does.
And for the most part, it does work, which is always just baffling to me that it works. But because the idea is that it's so highly absorbable that nutrients are absorbed before they can reach the bacteria in the small intestine. And so you're essentially starving them for 2-3 weeks.
Yeah. Yeah. And sometimes I'm surprised too when I'm presenting the different options of like, oh, you know, these are the ways we can treat SIBO. Sometimes there are people who are like, hell yeah, I'll do the shakes. Then I don't have to worry about cooking all these foods. Like the SIBO diet can be tricky for people as well, especially if they don't love cooking or they find it quite overwhelming. So sometimes that option is actually quite helpful for people.
Yeah, no, absolutely. Completely agree.
Okay, so in our practice, because we take a very holistic approach to healing body burnout, including looking at metaphysical root causes of, you know, trauma, which can cause a trauma brain loop happening in the body, nervous system dysregulation, and a lot of the times there's unconscious core self-limiting beliefs kind of stuck in the unconscious state, dysregulating the nervous system. Have you ever seen this, especially like you mentioned, you get a lot of the tricky patients?
Yeah.
Have you come to a point where you've done all the physical stuff and all the protocols and still someone's body is sending them some pretty strong signals via the gut?
So I don't wait until I've exhausted every possible antimicrobial before I address this issue with them, because for me, it's pretty obvious when somebody has limbic system activation. And, you know, I make that early on in my appointments, I address that. And I recommend different types of therapies for people that I think are in this chronic state of activation, which is a really, I think it's probably more relevant today than it was even 10 or 15 years ago or 20 years ago, 25 when I started. It's people have a certain baseline activation now, I find that, and what I mean by that is external stressors like either finances or climate change or whatever it may be, it can trigger people and past old trauma and ways of being, and limbic system activation can happen because of perpetual trauma and this or perpetual basically activation. And so it's just that pattern that gets reactivated where people are just very much in a sympathetic nervous system state, so the fight or flight. And that can absolutely make it so that it's very difficult to eradicate SIBO quickly. And so these are the people, like I mentioned before, that it's very slow going, and we have to put a lot of focus on, I often recommend things like hypnotherapy, the Nerva app, deep breathing, Gupta program, brain retraining, or DNRS, so lots of different types of therapy depending on where they're at, to really start connecting the stress to their digestive system. And I think that's been really helpful, especially when people are really activated and have a lot of much more deep-seated conditions like MCAS. MCAS is just phenomenal with addressing with the Gupta program, for example. So I do that much more. I have that conversation much more early on in our appointments now than just going through. Like for me, just treating bacteria is not even the fun part. You know, that's just okay. That's easy. What we have to do. That's just a part of it. But really, you know, a lot of people have this rigidity in the solar plexus when they have this limbic system activation a lot of the time, or trauma activation. And that part is very often connected also to the fascia, to the to the diaphragm, to breathing. If you're not breathing deeply and you're always just shallow breathing when you're very stressed, this is what happens. And you're not really utilizing your diaphragm, that can just get sort of stuck in this shallow breathing pattern. That then, the lungs are meant to be massaging the transverse colon. So there is also that mechanical motility that's missing from all this. So there's a lot to be said about people that are in a state of chronic stress or trauma reactivation and all of that. And luckily, we now have a language to speak about this and to address it and to, recommend different things to people, like somatic experiencing and different types of trauma work that I find are so profound and powerful.
Yeah. Why do you think that you said that you see it more now than what you did, say, 20 years ago?
Maybe I just, I'm older, I'm more aware of, I think so. And I think, like, when you first start your own practice and I was always a very driven person, and I could really see that part of that was out of trying to get my own safety. A lot of people just want to, they're very driven to be recognized as something. But for me, it was always about finding my own safety. And as you get older, that's the beauty of getting older. For me, I love getting older because I have so much more of an understanding of my own patterns. And so seeing that, and I had a lot of digestive issues, now that I'm much more relaxed, I can actually see it a lot more in people. And I also think that we live in a much more stressed out world these days. If you look at what just happened in Europe over the summers with the fires, and now, like it's just relentless, the bad news. And so I think it really has, and then COVID happened and the lockdowns and now the economy, there's just always something that seems to be really affecting people on a different level. And the gut will always be getting the short end of the stick, so to speak, when stress is high.
Poor little guts. But it's like the big stuff happening in the world, although rationally we can be like, it's okay, it's fine, inflation rising or whatever, but that ingrained part of us that's always our amygdala, like the survival brain, it can, like for some people, they can get in that chronic fight flight state and not be able to switch out of it on their own.
Yeah, and a lot of it has to do with safety, right? So the whole limbic system, including the amygdala, it's all about, am I safe in this world, right? And so this is how we also know, for example, that adverse childhood events, right, have a way of almost imprinting onto the microbiome. People with adverse childhood events are much more likely to experience IBS and so forth. And so people with adverse childhood events then meet the stresses of more modern life, and that pattern just keeps continuing. So I've seen that a lot.
It is nice getting older. I'm almost hitting on 40, and I love my late 30s, and I think 40s is just going to be even better.
Oh my God, just wait till you get to be 50. Oh, it's the best.
This is like loose and free.
Well, I like that. That's never been my problem, but just more at ease within yourself. And that's what I like,
I love it. So cool. Well, thank you so much for coming on our podcast. It's been awesome. I know that our listeners are going to get so much out of what you've just covered today about SIBO and gut health. And if anyone wants to find out more about Dr. Nirala and she's got so many things, so many awesome things. So there's the SIBOdoctor.com for practitioners. You have heaps of courses.
Yeah, I have the SIBO. Yep. So thanks for that. So if you go to thesibodoctor.com, there's a course for practitioners called this SIBO Mastery course, which is very, very, very extensive. a certification program. And then for patients or SIBO sufferers, I have something called the SIBO Success Plan that includes how to get through the biphasic diet. And, I add in lots of different home treatments and hydrotherapy treatments and all kinds of different things that you can do to improve your symptoms whilst you're going through the protocol. And then I have different free resources and stuff. So it's a really good informational site also for people if they want to check it out. And then I have a podcast also that deals with all things SIBO that I've been doing for about almost 7 years now.
Oh, wow. It's been that long.
Yeah.
That's awesome. Podcast is awesome. You have amazing experts from all over the world coming on and talking about different areas of SIBO and how everything is connected. Also, great free resources. So we were talking about the underlying causes of SIBO. So you have the What Caused My SIBO questionnaire, which we use in our practice.
Great. Fantastic.
And so many very helpful diets. So the SIBO Biphasic Diet, histamine, oxalates, salicylates. Yeah, we use all those. And people can grab them off your website.
Yeah. Great. Yeah.
All right.
Yeah, that's a good resource for them.
Thank you so much.
It's been a pleasure. I'll see you around the tracks somewhere at one of the conferences.
Yes.
All right.
Thank you so much for listening. We so appreciate you. If you'd like to give us extra smiles, drop us a review and spread the love by sharing this episode.
You can also rate your own state of burnout and the root cause contributors by taking our Ending Body Burnout Assessment on our website. And if you're interested in learning about our group or one-on-one Ending Body Burnout programs, shoot us a DM via Instagram or Facebook. Have the best day ever.